strength like no one reaches to me.
Well, good morning and welcome to the CCG Hour. I trust that all is well with you and yours. And of course, you can say it with me by now. It is a great day to be alive. Once you're in the land of the living, once you're listening or viewing me this morning, it means that obviously you're alive. And I'm praying that you are going to make the best use of today. You could only do in today what you can do in today. Don't leave for tomorrow what you could have done today. So I have a new friend. Well, once anybody comes on this program once, then they kind of automatically become my friend. But yes, certainly I have a new friend. It's the first time you would be seeing him, but we'll talk. I'm going to introduce you to him in a little bit. I just want to open us up with a word of prayer, and then I am going to introduce him. So, Father, we just thank you today for your goodness. And Lord, even as we go into this program, we pray, oh God, your wisdom. Lord, I also pray that that which Ravon and I would discuss will be able to be of amazing benefit to those who are viewing and listening this morning. Lord, I pray that strength will come, that revelation will come. And as a result, persons who may have had issues in their bodies will be able to receive healing. Lord, we know that healing doesn't only come from the place of a miraculous touch, as in just it just happens out of the blue, but it can also come by you using the wisdom that you have placed on your servants. So, Father, we thank you for Ravon as my guest, and we thank you for your listeners and viewers that I have here with me today. And I pray, oh God, that you are going to use them all, use us all for your glory and for your honor. In Jesus' name, amen. All right. So, as I said, I have a new friend. Ravon, should I call you doctor? I'm
You
not
can
so
call me.
sure what's supposed to be your title.
You can call me Mr. Charles. That's okay.
I can call you Mr. Charles. But so I have a friend with me, a new friend, as I said, for the listeners and viewers, Ravon Charles. He said I can call him Mr. Charles. So I'll say Mr. Charles for the program. Ravon, Mr. Charles, welcome to the program.
Thank you. Thank you.
It's
Thank you
good
for
to
having
see
me on.
it's good to see a young face, a young man. Yes, I don't have very many of those. I have young people coming on. I have not had a very young man coming on, and especially to talk about what we are going to be talking about today. Ravon is a physiotherapist. So all of you with pain in the bones today, and maybe in the muscles and other places. And let me for I like to make the disclaimers very early, Mr. Charles. Here how I like to make it. This is not the doctor visit. The purpose of the program today is not to say, oh, well, I heard on the CCG hour that I could do this and that. So once I feel a pain there, let me do it. That is not the point of this program. It is for us to just talk about physiotherapy because I really believe that sometimes we hear of certain things, and because we have not experienced it personally, we tend to say many things about many people and many occupations. Sometimes you hear about the physiotherapists and all they say, man, these people and them only want to make money off of people. You have these kinds of comments, yeah. So Ravon, I'm making sure I talk all my talk now because then when I reach to you, I don't have much to say. So for those of us who are viewing and listening, I really want to encourage us. And me talking is giving you time to put away, load on the pot and, fire and whatnot. So when you sit here and Ravon begins to speak, we have your undivided attention. So right now, I've said enough. Ravon, Mr. Charles, we want to look at physiotherapy. As I said, we know it exists, yes, but I believe, and you would be able to tell me more so, that it is not the field where everybody run to you, they don't run to you all first, ain't it?
Yeah, that's true.
Yes. So let's talk about it. What is physiotherapy? And of course, why under what conditions, would people need physiotherapy or the services of a physiotherapist?
Okay, so physiotherapy is what we do. It's basically we deal with restoring, maintaining, and improving someone's function or movement. So let me give some examples to really explain how this goes. So, for example, if you're an elderly individual and you're having some pain and discomfort, and this is hindering you from walking up your stairs or doing your day to day, like going to the supermarket, then we would consider that in physiotherapy as a something that hinders your function. So if you
Mhm.
are in that range, then you can come in for physiotherapy.
Right.
Also, if you're a white collar worker or office worker and
Right.
you're doing your office work and you're having those neck pains and so forth, and that's hindering you from doing your work, or you're typing a lot and then your fingers are starting to have pain, and that
Mm.
prevents you from typing and doing your office work, then that is an indication that you may also need physio. And also if
So
you are the
ergonomic issues.
yes, ergonomic
Mm.
issues,
Okay.
as well as if you are a blue collar worker
Hmm.
and you're having that back pain, or you're the construction worker and you're going and that back pain is preventing you from going to work and lifting those heavy objects, then
Mm.
that's an indication that it's an impairment that's affecting you from doing your job, doing your duty. You
Okay.
also need physiotherapy, as well as
Mm.
you're that athlete and you have that hamstring strain, or that ankle is giving you issues, or that knees is painful, and
Mm.
that prevents you from achieving your ultimate athletic performance or
Hmm.
performing at your best. That's an indication that you probably also need physiotherapy,
Right.
as well
So,
as
mhm.
yeah, go ahead. Oh,
No,
as
no, I
well
was
as
just wondering, as you mentioned the last one with athletes, I'm just kind of wondering, because you identifying and categorizing, I was just wondering whether there are degrees to the pain that you're talking about there for the different categories. Is it that once you feel a little pain that doesn't go away, or how would you know then at which point to come, even if you are experiencing, some of those pains for those categories of persons that you're mentioning?
okay, so as one thing we use in physiotherapy is called the numeric pain scale. So
Mhm.
it's ranges from 0 meaning no pain at all and 10 meaning extreme or excruciating pain.
Right.
So if your pain is within the region of greater than 3 or above, and not only that you're having pain, but that pain is also leads to some muscle weakness. So you have maybe muscle weakness, or you have a loss in range of motion as well. That would be some things that you can indicate to you that you probably would need to see the physiotherapist, because that these are things that we consider as impairments. Those, if you have loss of muscle strength, range of motion, you're not able to lift your hands. Before you could have lifted your hands over your head, but now you can lift your hands over your head. So
Mhm.
combing your hair becomes difficult. Reaching to the cupboard becomes difficult because of lack of range of motion, as well as, let's say, if you are a track and field athlete, and due to that hamstring strain, you're not able to run as fast as you can. So that hamstring muscle is not able to produce that power that you
Mhm.
need to get to, or to perform at your athletic best.
Okay. All right.
Mhm.
So so based on what you're saying there though, um, why would someone, or how would someone, maybe I shouldn't say why yet, I'll leave the why for a little later. How will someone know that they need the physiotherapist and not just go to the doctor? Because in Grenada, I'm sure you know how we tend to say it. You have a pain, so where do you go? Let me go to the doctor, which of course will equate to our general practitioner. Go to the doctor. You hardly ever do I have not heard many people saying, "Oh, I'm in pain. Let me go to the physiotherapist. I'm in pain. Let me go to the doctor." So how would people decide, you know what I mean, which one? I'm hearing what you're saying, but how do I know, instead of going to the doctor, let me seek out a physiotherapist instead?
Okay, so both options are viable. So
Okay.
in yes, both options are viable. But for us as physio, what we mainly work on is function. So for example, there may be let's say for example you have low back pain.
Mhm.
Okay, so majority or most of the low back pain is related to non-specific low back pain, which is maybe a muscle or a ligament or a tendon or maybe your facet joint issues that causing the pain. So in that case, as a physiotherapist, we are also trained to give an assessment. So
Right.
if you're coming for physiotherapy, we would give you an assessment, and through that history taking and that physical examination, we would determine if you would need to have physio or you would need to be referred to a specialist, maybe an orthopedic surgeon or so forth, or a neurologist.
Okay. Okay. Got
As
you.
well as if you go to the GP and there's an
Hmm.
issue where they would believe that you benefit from physiotherapy, they can also refer you to a physiotherapist. So it
Right.
goes hand in. Yeah.
Okay. So once I feel that type of pain that you are describing, if I go to either one, I would be able to get help and get further assistance.
Yes.
Right. Okay. So that makes a lot of sense. All right. So they're not the same, but they work hand in hand. All right. I'm wondering, therefore, you mentioned about athletes. I don't know if I should, leave that one for a little later, but I certainly want us to talk about that because I know that sports season coming up, and you see a lot of interesting things. I've been a teacher for quite a number of years, and I've seen some children who they don't like to run, they hear nothing but run, don't want to hear about running or sweating, and now it's sports, and oh Lord, this poor child has to go and run races. And let's be real, with little or no training, and you have all of those. Do we want to talk about it now, or do we want to talk about it a little later on in the program?
Anytime, now or later, I'm okay. I'm fine.
Okay, so I've raised it. So let's
Mhm.
talk about it because I'm thinking we might stay there just a little while,
Mhm.
because I would really appreciate if you could end up, give some tips to parents and so forth, who might be listening, because we are a society that love our sports, and when it's sports season, everybody who can't run runs. Um, Amid what we know is obvious, which is yes, you should obviously warm up, you should obviously. So we know a lot of obviously, but I'm thinking the how of the obviously is the issue in many cases. So for children, starting from the young, what we would call, really small children, maybe like in the, in the kindergarten department, um, how would we ensure that children do not need to have to come by you? I don't know if because I'm thinking once they come by you, it's because we have an issue. Yeah. How do we ensure, what is it that, as parents, as school and so forth, what can be done in order to safeguard our little muscles and our little ligaments and so forth, so forth? Talk to us about it, about children on the whole, children and physiotherapy, children and health.
Okay, so what we're getting into is something that's called injury prevention. That's what I think that the question is leading into. So
Okay.
as it involves with children or so forth, I would say that one is someone is going to participate in any physical activity, you need to hydrate. We live in the Caribbean, it's hot. So hydration, water is very important, as well as electrolytes, because electrolytes is something that you need for your muscles so that it can help prevent muscle exhaustion as well as cramps. Okay? And
Mm-hmm.
apart from that, I would also say it's really important that as we get involved when it comes to talking about sports, that it's a multidisciplinary team. So the coaches would also really need to be involved, and you need to have specific preparation
Mm-hmm.
in terms of that. If someone is going to participate in any physical activity, or or in competition, if you're going to participate in competition, then I would say that they should go through a training program that is progressed through a period of time, so that as they get into the competition or as they ramp up, they do not get injured.
But that is the ideal, Ravon. But the truth of the matter is, we are going into December. And I think that there are some schools that have already begun to do cross country.
Mm-hmm.
And I mean, we've been very practical. You are speaking about the ideal. And maybe in, of course, in the secondary schools, yes, you will have your, let's say, your intercall team, or maybe even in primary school, those students that are selected and, you know that they're your athletes. Yes, they will, I believe, go through the proper training. But then when you have a school with, I don't know, 600, 500 and something children, 400 and something, and now it's time for cross country, and we all encourage to send them out and everybody go, and then trouble in the road. So I understand what the ideal is, but how do we genuinely at least give some kind of help and support to, or maybe even assurance to those who may not be a part of this training, or maybe not taking it seriously? Because if you have games once a week, as I know it is for some students, for some class, it's once a week, let's be real. And then there are some days we know for sure that games, what we call games, physical education, doesn't
Yes,
take priority in some schools. Yeah.
Yes.
So sometimes 2 weeks pass and nothing happens. But then after that 2-3 weeks pass, it's cross country that the 4th week. And everybody is encouraged to take part because you have to give your house a point. So how do we help? Because it is something that is on my heart, because as I said, as a teacher, I've seen things, and I couldn't put my mouth to say anything because I'm certainly not on the physical physical education. Yeah. So I'm not an expert, so I would have been quiet. But now I have you here. So what can we honestly say to the person who, children who might be wanting to participate, and how do we really assist, or can we assist at all in this area?
In terms of, I would say that the ideal is important, but sometimes you cannot really get to the ideal.
Yeah.
As I mentioned before. So what I would say in this, short term, like if someone is going out and they don't have no experience of running or so forth, or like this is their first time running, then, and they don't have no experience, I would say first, it's not really recommended that if you're not accustomed to doing something that is very aggressive. So let's say for example, if you go to run like 6 miles and you haven't run 6 miles before, then
like cross country.
Yeah.
Is that
Yeah. I would say that yes, I'm someone that I advocate for persons to take part in physical activity. But there is a way and a process that you do that. And if you go, and there's something that's called too much too soon. And if you do too much too soon, that would lead to injury. So if someone hasn't properly trained or properly adapt or go through a process where they properly adapt their body to that specific stress that they're going to be exposed to, then there is a probability that they may get injured. That's the truth about it. Sometimes they may not, but sometimes they may get injured. That's just the honest truth.
Right.
So
would you recommend? You remember long ago? Well, I'm saying long ago because I'm not really, in school for the past few years. You would see children, they know cross country or sports coming up. That's what we normally say. And then you would have seen a lot of children. They're going and they're practicing and they're running at least a few weeks and so forth before. Maybe sometimes without an adult. Sometimes it's just a few children coming together. Will that be still better than not training at all?
Of course. Because yeah, of course, yeah, because one of the things that if you go and you start to run and you get your body adapted to that level of stress, then it reduces what could happen on the day. So, for
Right.
example, one thing that you would see in cross country, and not and normally, and I'm sure that if you're away, if you look at Olympics, you normally wouldn't see that. Like if someone is running a 400 meter, for example, a professional athlete running a 400 meter, you'd see they run the entire 400 meter and they don't fall at the end of the race because
Exactly.
over a period of time that they train and they adapt their body so that
Mm-hmm.
on the day they can execute and they don't have that issue. So
Yeah.
if you are like from zero and you haven't run for a 400 meter before, or you haven't progressed to running that on a competitive level, or a competitive level meaning that you have to meet a specific time or you're trying to win the race, then and you go out and you go at a very high tempo and pace, then there is something that can lead to have muscle fatigue. And if you start to get muscle fatigue, then you get that level of acid build up in your muscles, and then your muscles become tight, and that's why you end up falling at the end of the race. Sometimes your muscle is tight, and as well as the level of carbon dioxide that comes as you run, you might not be able to adapt to that, and you have this heavy breathing and so forth. So I would say that it's a process. I would always advocate that you train. Training is important. So even though you could do that little training, even for the kids for themselves, to get the body adapted to some level of stress, some level of physical activity, I think it's better than nothing at all.
Than nothing at all.
Because when you have nothing at all, then injuries could happen.
Right.
And
do you get to see, I mean, in your practice, do you get to see, I don't want to use the word many as if I'm trying to find a number, but do you have a great enough number, a significant enough number of children coming to you? When I say children, I'm looking at between let's say 5 and teen. Do you have many of those coming to you, or is it that we are doing a lot of self-medication at home? I mean, you would know our culture, especially as it relates to this, and I'm leaving the sports there because it's still kind of related to sports. But yeah, do you have a lot of children coming to you, or is it like a special group of persons that usually tend to end up coming to the physiotherapist?
well, what I would say for children, I only see about few, maybe two or three patients that I would classify as children based on the age range that you give. But the
Yeah.
majority of the clients that I do see, it's one is low back pain for sure. That's the majority, low back pain, and there are individuals that either they came from overseas and they had an experience with physiotherapy and used to have physiotherapy before, and now they're back home and they want to continue their physiotherapy, so they come to have physiotherapy.
Right. So
Or
it's
they are like past athletes before, and they are aged and they have an issue, and they have that level of experience before being around sports and having physiotherapy, that they know the benefits of physiotherapy, so they come for physiotherapy. So that's mainly the classification of the patients I
so
see.
so so then it's not that the field is well, maybe I shouldn't say the field, but the service is not well used through in our culture as yet right now.
No, no, I don't think it's really well used. I think that currently it's a field that has been around a while in Grenada. Yeah,
Yes.
but I think that the public is not really aware of what physiotherapy is, and sometimes when persons come from physiotherapy, I had some clients before that used to think that we do the same thing as what massage or masseuse does, and it's a different field. That what we do, yes, we do use massage because massage is one of the tools or the techniques that we have to utilize in ourselves. But what we do as physiotherapists and a masseuse is a bit different.
Well, can you expound on that a
Yes.
little bit? Because I won't lie
So
for you, I personally know it's not the same, but I did think that there was a lot of overlapping, so much so that you could go to the masseuse instead of going to the physiotherapist. So expound on that a little more for us.
Okay. So as I mentioned before, as a physiotherapist, we are individuals that we deal with function. So our main goal is to getting you back to do your day-to-day, or returning you to work, or returning you to sport, or whatever physical activity that you want to do. And you're having pain, or you're having muscle weakness, or you're having some range of motion deficit that is preventing you from doing that, then we will assist in that. So some of the services that we offer. So as example, as I said before, we have manual therapy. So manual therapy would also include what we say massage, or what we will call sometimes soft tissue mobilization, where we'll use our hands and we're gonna find that specific muscle that probably might be that might be a bit tight or so forth, that could be causing some of the range of motion limitations that you have, or the pain, and then through applying some force, then we're going to try to reduce that pain or stiffness that you have in that muscle. As well as we have joint mobilization, manual joint manipulation, so forth. As what persons will see what the chiropractors do, the cracking of the bones, joint manipulation, and then we have a wide variety of modalities. For example, electrotherapy, thermal therapy, hydrotherapy, shockwave, therapeutic ultrasongs, all those modalities that we use that can help increase blood flow circulation, reduce muscle stiffness, help reduce pain, and so forth. And also can be used in the way of using like a biofeedback to help improve that muscle contraction, or that help improve motor recruitment of your muscles. And even apart from that, we also have one of our tools is movement, or exercise. So we would definitely use exercise to help improve your strength, your power, your speed if you're an athlete, or so forth, and so forth. And even apart from that, physiotherapy, we also have different specializations. So just as I'm not talking about differences between a masseuse, but I'm just going to make a side mention as a GP, or a medical doctor. So in physiotherapy, we have different specialities. So we have, for example, someone who generally practices physiotherapy that would see a wide body of patients, whether it be low back, whether it be patients who have musculoskeletal conditions like a low back pain, knee pain, or people who have maybe a neurological condition like stroke or Parkinson's disease, or someone who has a cardiopulmonary issue, COPD. But we have persons that, if you can go specialize and become a specialist and be someone who only specializes in dealing with musculoskeletal issues, or orthopedic issues. Just as a medical doctor, you have that orthopedic surgeon, you have that orthopedic physiotherapists that are specialized in dealing with those orthopedic conditions. As well as you have a neurologist, you have that neurological physiotherapy that is specialized in dealing with those neurologists. So it's more or less it's wide, it's vast. It's not as to say that, well, I should go on to say one of the requirements if you want to become a physiotherapist from the world body is that you must have a bachelor's degree. Minimum, you must have a bachelor's degree. So anyone who practices physiotherapy and qualified, licensed to practice physiotherapy, well, in Grenada or anywhere, has a minimum a bachelor's degree.
Bachelor's degree, of course, in physiotherapy.
Yeah, in physiotherapy,
right.
yes. Yes, in
okay, and that's your basics. That is actually your basic. That's where you start.
Yes, that's where you start. And then you can go ahead and specialize in your master's, and whether it be specialized in musculoskeletal, neurological, physiotherapy, as I mentioned before, all those areas. So all those areas you have as a physician, you can specialize in all those areas, as well as in physiotherapy, you can also go and specialize.
Okay. What about the idea that, well, you need the physio, when you had an accident. You tend to say that, oh, well, this person had an accident, or maybe they had a stroke. And I heard you mention stroke earlier on, but even somebody had an accident. So you get the impression that well, maybe that's when somebody would need a physiotherapist, or maybe as I hinted before, to us self-medicating, because we love to rub. Um, I mean, what do you call it? Dengue? Oh no, not dengue. Oh my goodness, that's the disease. Dengue. I think
Yeah,
I'm
Bengue,
saying it right.
Bengue the muscle
Yes,
rub.
yes. Oh
Yes,
my
yes,
goodness,
yes.
I said right. So that and the icy hot and
Yeah,
all
the
these
icy rub.
different
Yeah, icy
things,
hot. Yeah.
yeah, that we tend to buy out of the pharmacies, and we rub each other. Everybody. Of course, once you can't reach an area, you go rubbing. You get somebody else to rub you. At which point would somebody know or should know that maybe this is not the best time for me to use icy hot or Bengay or whichever one, all the other diclofenac gel and whatever. At how will somebody? I mean, because we already, when I say people already have in their mind that, hey, these people, you all from the time they hear a different term other than doctor, these people, they come to take their money. Yes, I mean, we've been very Grenadian here, right? And I'm sure you get that too. People, maybe they have the impression that, oh my God, if I have to go to the physiotherapist, it is going to break my bank account completely. Plus, they're thinking that y'all are going to tell them, hey, you need to keep coming back. And you hear that again in our Grenadian culture. Well, how much time I have to come back? So I would like you to deal. I know I'm asking about three different things all in one, but please address them for me. The one, as I said, at which point do you leave from rubbing yourself and getting somebody to rub you with all these other things and come to you, or, and of course, talk to us as well about the cost. Just how affordable is physiotherapy if it is that somebody needed, because people, I'm sure, are using that as the reason why they would not reach out to somebody like you.
So what I would say that before I start, there is a cost to everything. Nothing in the world is free. You know that there is a cost if you go to see a medical doctor. There is a cost if you want to buy a car. There is a cost for food. So there's a cost for something. So if someone provides you with a service, there's gonna
Mhm.
be a specific cost that will be associated with it. Nothing is free. So that's the first statement. So as it regards to the icy hot or the Bengay or the different types of muscle rubs that are there,
Mhm.
these things would give you short-term temporary pain relief based on the properties that they are made of. They would give you some short-term pain relief, but as these things are mainly used for soft tissue issues, like let's say, for example, you may have a muscle strain,
Mhm.
right? Or also or maybe ligament issues where you may have a muscle sprain. Not muscle sprain, sorry, like an ankle sprain, like some of your ligaments
Mhm.
are sprained. So they will give you a short-term pain relief, but as it relates to function, for example,
Mhm.
getting that muscle activated, getting that muscle being able to contract, getting that muscle to be able to function the way it's supposed to do, let's say, for example, if you are, let me use one example. If you're a farmer, let's say you damage your rotator cuff muscle.
Mhm.
Yes, you can rub it. You will get some short-term pain relief, and then
Mhm.
as soon as you start to go back to the activity,
Again, yeah.
it flares up, it comes back up. And then you're gonna
Mhm.
go through that, you're gonna do that cycle over and over, perpetuate that cycle over and over until you become something that's really chronic, and then you get it.
Mm.
I can use it when water becomes more than flour, then you come to see
Yes.
a medical doctor or physiotherapist.
Mhm. And by then,
And by then the issue has become so chronic, then your time frame that could have been shorter now would be very long, very, very long extended, and we may not even possibly get you back to where you was before,
wow.
based on
Mm.
based on the severity.
What is
And
right?
yeah, severities and sometimes if it's really severe, you possibly may need surgery.
Wow. So
Yeah.
somebody who I'm still gonna try to pin you down a little bit better to the cost, but I'll come back to that in a while. But
Mhm.
but somebody who, let's say, felt the pain. I just want to go back to that because I have a feeling that we're speaking to somebody right now, a lot of somebody's who would have felt the pain, I don't know, since last month, they did whatever, and they feel that pain in the shoulder or in the back or wherever, right? And they did the icy hot thingy or whatever it is that they put. And of course, they went up on university YouTube. Who
Mhm.
doesn't go to university YouTube? So they went there, of course, and my God, they've been trying everything other than coming to you or going to the doctor. But during that time, of course, they're also continuing to force this, whatever they don't know is really going on inside of their bodies, right? Okay. The question really is now just how much, because a lot of people I know could grind a lot of pain. Just how much, if at all, should we be using an area in our bodies where we realize that the function has been interfered with? But of course, I have work to do, and all the reasons that we come up with. How do we deal with that? How do we really avoid having to come to you or to others like you in your field when the thing is water more than flour?
Oh, so I think the question what I'm getting here is how do you come to me before things is water, wood, and flour?
Well,
In terms
yeah,
of yeah,
yeah,
no,
because we
I
really think we could
mhm,
just rub it a little bit, and once we feel a little better, let's go back and do what we were doing. That's the mindset.
so I would say that if you had an injury or you force your shoulder and then you feel something sharp, a sharp pain or you get a sensation like something you feel like a pop or a tear, then that's some indication that you have some level of muscle tissue damage, right?
Okay,
So if you have that level of muscle tissue damage, I would recommend that you go to see a doctor or a physiotherapist to get that checked out because you you have to go through a specific assessment and I would have to see the individual or that medical professional would have to see that individual and go through an assessment to really quantify that how severe that injury is. It's difficult
right.
just to say it on air, but you'd have to see that
Mhm.
individual and to see what actually is the issue that they have and how severe it is. So you have to go through an examination or assessment to see that.
Mhm.
But some of the just very basic indications, as I said before, is you feel like a pop or you feel a sharp pain, and that pain is let's say as I mentioned before, 0 to 10, meaning 0 meaning no pain, and you have 10 meaning excruciating pain, and you are like greater than 3, you're in that range of 4, 5 or above, then yes, you need to see a physio. Or if you notice that there's inflammation, as soon as you had the
Mm.
injury, you notice that there's inflammation, and or
Right.
there is immediate loss of muscle function that you're
Mm.
if you go to try to contract it, it's painful.
Yeah.
You know,
Mm.
these things, inflammation, redness, loss of muscle function, severe pain, excruciating pain, as well as those things that you would need to see a physio, as well as if you're having things like numbness or tingling sensation, that could be an indication that you may have some peripheral nerve damage. So
Right.
that as well too, you would need to see a physio or a doctor, a medical professional to get assessed and properly assessed to see to understand the severity of what you may be having.
Okay. And so coming back to the issue of, oh my goodness, is a lot of money. How long will I have to be coming back for? Because I have heard with my own and many people will say things like, "Oh, I went to the doctor and look, just to go back to the doctor with the result, you have to pay him again." You hear people making those comments, and I mean, of course, I agree with you. Everything has a cost. We all know that. But for somebody here who may not have the mindset about, oh, it's too expensive or things like that, who genuinely, they're looking at this program and they genuinely just want to know, hey, maybe it's about time I deal with my pain, I deal with some of the issues I'm having. What is the kind of price range that somebody can expect to have to pay if it is that they just have to visit a physio? Right, whether it be you or, because I mean, I know generally in the field there is a range. So I'm not asking you for your fee per se. We just want to know range.
So I would say anyway for maybe a first session, a consultation, a visit, it can range from anywhere between 100 to 150. That's one visit, okay?
Right,
Yeah,
and that's kind of
and
like
that's
the regular fee anyway.
regular. Yeah.
Yeah,
Mm-hmm.
that's kind of regular fee. Um, there are individuals who may have been very active before and would have
Mm-hmm.
sustained some kind of injury. They knew that whether it is that they damaged, I don't know, their knee, or maybe they're losing. I don't know if I'm saying it right. Can you lose cartilage or lose?
Yes, you
Um,
can. If
right.
cartilage
So
can degenerate, yes,
right.
yes.
So you might have persons with those issues. And
Uh-huh.
again, nutmeg. We in Grenada, so a lot of people I know feel that nutmeg is, with all due respect to the product, it is, a cure-all. Once there is pain that appears to be muscle pain. For people who have gone through whatever, and maybe they might be saying, "Oh, well, I went to the doctor already, and oh, they can't fix it." Would you say that because the person have had the pain, that even if they continue to have it, it may not be the same issue that they're having, and that they need to come back again or should go back again to a physiotherapist or so forth to get reassessed?
Um, that's a very interesting question. I would say that it's yes and no. It could be the same issue. It could not be this. It could not be the same issue. So, for example, let me give an example. If you say you're having knee pain, right, and due to that having knee pain, it may cause some level of compensation with how you walk or how you do your day to day. That may lead to you having hip pain or low back pain, and that is a
Hmm.
result of having compensatory movement patterns that led to you may having hip pain or back pain. So in that
Oh,
instance, yes, that one issue could lead to other issues that you may need to address later down, or that one knee pain could only remain that one knee pain because it's depends on the individual. There's individual differences here. So if it's that one issue, then I would say if we going about and talking about knee pain it's complex. There's more than one issue injury that could happen to the knee. It could be a ligament issue, example your ACL or your MCL or your LCL. Right? It could be your meniscus tissue that's damaged, or it could be something as your patella tendon. Right?
mhm.
Or it could
And
be
of
something
course,
that's
all of these L's and tendons and ligaments, the lay people, would not know what, would
yes,
not be able to just feel a pain and know it's one of those abbreviations that you use that might be the problem.
yes.
So
So
you have
if
to come
you
in.
yes.
Okay, so you'll have to come in. All right. I asked the question because I'm immediately thinking of someone that is very dear to me that I have seen, an elderly person is a retired individual, but I've seen this person. You can see that the person is not experiencing, not the best of it. The health is not the issue as much as it is the knee is the issue, and you can see that person um having to favor the one side, and so forth, and you can see them trying to use a lot of different strategies to overcome having to use the knee, but by and large you can see that it's really painful. Of course, the truth is I don't know for sure if the person has ever gone to physiotherapy, but if somebody has, let's say like the one I used there with this person, let's say it's a cartilage degeneration that
Mhm,
is taking place,
mhm.
will physiotherapy be able to help in that? Because in this case, it's function, yes, but can physiotherapy help for people like that, and for maybe even for people who have things like arthritis and so? Because I'm thinking of the viewers that we usually have, And I'm thinking, I know some of them may be the ones who might be suffering or have issues with those things that I'm asking about right now.
Yeah. And link cartilage loss, normally when you have cartilage loss over a long period of time, it leads to osteoarthritis. So it leads to the same thing I just mentioned, osteoarthritis. So
Mm,
osteoarthritis, it's a structural issue that deals with the joint, the wearing away or the degeneration of that cartilage. So from that standpoint, if the cartilage starts to wear away and it's degenerative and it's going to progress over a period of time, then from a structural standpoint, if that's the issue that is causing your pain, then from a Western medicine perspective, then you can take some painkillers that would help relieve some of the pain. But if the issue is that structural, then you would need to have a knee replacement surgery, because
wow.
that's what the guidelines recommend. If you're having osteoarthritis and the symptoms and you cannot moderate the symptoms, and you really cannot bear the symptoms, and there is no strategy or method, whether it be from maybe some painkillers or using some temporary heat to help reduce that pain, and you're trying to do some mobility exercises, some movement, and this is not really helping at all, and you're in that last stage, then yes, because in as we walk through day to day, the joint is one of the things that it helps to absorb and transmit force.
Mm-hmm.
So if there is a structural damage within the joint and the joint is not able to transmit force or absorb force, then then the issue could get worse, in terms of that if you're not able to absorb or transmit force, and the forces that comes through the joint can increase that level of deterioration over a period of time. So
Wow.
in that case, the most thing or the best recommendation would be a knee replacement surgery. And after the knee, or even before the knee replacement surgery, from a physiotherapist's perspective, then we would work to help maintain some level of function, whether it be to help ensure that you have that knee range of motion, the muscles that is around the knee are strong, can absorb force, because normally one thing that happens, a lot of persons don't know that. A lot of things that happens when you have a knee injury, there's something called autogenic inhibition, where due to having that damage or that soft tissue damage within the knee, or that structure damage within the knee, it shuts off the nervous system of the muscles that are around it. So example, the quadriceps will not normally quadriceps will contract, but you wouldn't have that level of contraction within the quadricep muscle. So and if you don't really get that rehabilitated or get that muscle recruitment going from early on, or that initiation, then the quadricep might not be able to contract. And if you're not able to contract, then you cannot help to absorb some of that forces that will come through your day-to-day walking, if you're running or so forth. And then majority of the force will go towards the knee, and over a period of time that can perforate, and then you get that osteoarthritis. So going back to what you said before, if things are like really bad, or we say water more than floor, it's the point where if you cannot afford a knee replacement surgery, then we will have to try the best as we can to try to help modulate that symptoms. But it wouldn't, I'll be very honest, it wouldn't go away. If you have osteoarthritis, it wouldn't go away. Well, currently now, with what the knowledge that we know, that it wouldn't go. Maybe in the
Right.
future, if new research comes out and we find a way,
Yeah,
then you can treat
yeah.
it. But currently, then if you have osteoarthritis, and the symptoms is very bad, you're not able to bear that symptom, then the first option would be surgery. And even after surgery, you still would need physiotherapy after the surgery, because once we change that structure, the reason why you're having that pain, then we have to regain that muscle function, regain that range of motion. So regaining that range of motion, regaining that muscle function, also re-educating you how to walk, because you need to walk. So all this would come into my field after you did the surgery. So
All right. I have one last question before we take a quick break. And when we come back, I just would like you to share,
Mhm.
details as to how maybe somebody could contact you, because you cannot come on this program and then not be available for those who might really need to reach out to you. So we'll share that in the end. But just this quick question, before the break. For someone who is you use the term compensate. I do not want to use the wrong phrase, but I know what it means. Whereas
Mhm.
someone favors because they have an injury or
Mhm.
is an impediment in one way, they favor the other side. I just wanted to just talk, bring a little more depth to that, and then as I said, we take that break because I think we do it without even knowing that we're doing it. And maybe if people are aware that that is what is happening, they can be a little more vigilant to avoid doing it when they have an injury on one side.
So one of the compensatory patterns you can see, let's say for example, you have knee, and these compensatory patterns could be for a number of reasons. It could be one, it could be due to pain, or it could be due to maybe you may not have the after range of motion in the joint. So due to not
Mm,
having a range of motion, then you get a compensatory pattern. So if it's a issue where it's due to pain, and the reason why you're having that pattern is because of the pain, then one would say that if we get rid of the pain, then that compensatory pattern will go away.
mm,
Now, if the compensatory pattern is due to a range of motion restriction within the joint, whether it be the ankle, the knee, or the hip, then we would need to address that range of motion restriction. So
mm,
if you have a chronic ankle pain, or like you have chronic ankle sprains where you get ankle sprain on and off, on and off, on and off, that one of the things
mm,
that could lead to some stiffness in the ankle.
mm,
So you would need to have that addressed, because if you don't address that impediment, then it's difficult to address the compensatory movement patterns that will be associated with it.
mm. Okay. So
If I'm making sense.
yes, you are. But because we use the phrase compensatory patterns, just in terms of definition of it, this is when someone is having an issue. So if I have a problem with this arm, I
Mhm,
begin to, because I do not want to put too much strain and pressure on it,
mhm,
I begin to use my other side more now.
mhm,
And then, of course, because I'm using the other side for, well, most of what I'm doing now I end up getting pain over on this side as well. That is the
mhm.
case, right? Just for clarity.
Yeah, yes. That's one of the cases, as well as the other cases can be
Right.
where, for example, it could be on the same limb too as well. Let's say, for example,
Mm,
you're not getting enough ankle dorsiflexion. Or no, let me use this example. For example, knee extension, because if knee that's a good example. If you don't have proper knee extension, then you won't be able to your gait, you have issues with your gait, so you could have a compensatory pattern with your gait. So if you don't have proper knee extension, then what could happen? You could have that limp. You can walk with
uh-huh.
that limp on the side, or
Hmm.
yes, you can walk with that limp. So 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 it can happen on the same side, or it could happen on the other
Hmm.
side.
Right. Okay. And on both cases, or in any of those cases, the idea is once you begin to see that you are compensating, you realize you have
Mhm,
an issue here. So you begin to ease up or do whatever it takes to ease the pain. We're talking about finding you
mhm.
or someone like you.
Yes,
Yeah. All
yes,
right.
yes.
Great. Let us take a quick break. And as I said, when we return, we'll just share information as it relates to how persons can find you. All right. So let's take a break. We are going to be right back.
You are my strength, strength like no other, strength like no other, reaches to me. You've never been closer than you are right now.
Let's sing it out, y'all.
You are my strength, strength like no other, strength like no other, reaches to me.
And we are back. Well, thank you very much for staying with us. For those of you who may have just joined the program, well, if you did, my goodness, you missed the whole program because we actually took just a quick break. And then Mr. Charles, who is a physiotherapist, as I said, for those of you who may have just joined, he's going to just be sharing with us some wrap-up statements as well as to share how you can reach out to him, because I am very certain that there are some of you who are listening and viewing the program who may very well need his services. Maybe you are at home and you know that you've been favoring that leg, you're watching the thing and you keep putting soft candle on it, and it's 2 months now you're putting soft candle. It's not going away. And this is not me doing the best advertisement for him. I don't think I'm doing a very good job of advertising for him, but I'm trying. The thing though is this: if it is that you know you've been using whatever you're using and the pain is not going away, please stop suffering yourself. Reach out. Yes, you might be like, oh, I can't afford it, but here what? You need the function in your body, right? So, Ravon, please share with us your practice in terms of where people can reach you, how that kind of thing, so that we be able to assist those who might want that kind of information from you.
So yes, so currently, mainly I operate out of Hills and Valley Medicare Center. That's in St. George's, Granville Street, St. George's. So there's two numbers that you can call. You can call 420-3848. Let me repeat: 420-3848 or 435-6904. So you can call these two numbers. The first number is the office number, and the office persons would take your information and they're gonna let you get in contact with me. Or the first number that I give you has to do with my number, and you can take those two numbers and you can get into contact with me, and then we can help to sort out whatever issues that you have, functional issues that you had, and hopefully we can get you back on the path to moving pain-free and doing what you love. If you're that individual and you have that knee pain or that issue you have and it's preventing you from playing with your grandkids, then we can find a way, some method or strategy that can help assist with that, so you can get back playing with your grandkids.
All right. Okay. And of course, for those who, even if you got a number, but you can easily remember Hills and Valley Pharmacy, you could just call and say, hey, I hear you have a physiotherapist guy. The people and them that does do what, even if you give the description, they'll know what you mean. Yeah.
Yes.
One last question before we go. This question, it just came to mind. Very simple. It's for, as you mentioned, if someone has their grandkids and they just want to, get back in motion and be there with their kids, their grandchildren, and so. If it is that someone may have had, whatever might have been, like the example I use with the soft candle, they have the issues for however long, they just weren't bothering with it and whatever, and then they come to you. and I know you might not be able to answer because, of course, I know each case is different. I appreciate that. But if it is that somebody very older, elderly, is coming with an issue, as I said, that has been there for a long time, what would you say to somebody like that who might be thinking, well, I old already and I had all this pain. Some people, I had all that pain for years. If I go now to the physiotherapist, or if these people, and they might just make my pain, make it worse. What honestly would you say to them? Because as I said, I do believe I'm speaking to some people, to some persons this morning who really need to reach out to a physiotherapist. Yeah.
So what I would say to those individuals, like if you having severe pain or you're having some functional limitations, I would say seek medical advice. So it could be from a physiotherapist, it could be from a medical doctor, but seek medical advice. Because if you're having some medical condition or issue that is affecting your life, then getting advice or knowledge from an expert and what is the best strategy or treatment process that you can go about, it makes the world of wonders. And it could be something very simple. And if you can get that started out, then the life will be better.
Regardless of the age.
Yes, regardless of the age.
Because that is what I'm looking at, the age. So if you're 80 something and 90 something, don't just put it off and say, oh, well, I old already. And it's old age that giving me pain, because, I've heard that too. What is the old age? That is what, once there is an issue with your functioning, and there's pain and whatnot involved, there is a reason. You have life and you are entitled to the best quality of life, right? So, Ravon, closing words. I am so grateful that you could have come. Closing words. Let us just say quick goodbye to the folks who have listened and viewed with us today.
So we say thank you for everyone that came onto the program and listened to the educational advice that I had to give. Once again, I would say if you want to reach out to me, my number is 420-3848 or 435-6904, or you can contact Hills and Valley and they're going to get you in contact with me. So thank you again for listening. I enjoy the program. I would love to be back as a guest to give some more advice.
Well, there you go. I didn't have to even pull yourself and say, "Are you going to be back?" So I'm glad. I want more of my guests to say that. So you can take it for sure. You can be guaranteed that you are going to be back. Seeing that I did not have to ask you again, all the more reason for you to be back, right? Thank you so much for coming. Thank you, ready for coming. I'm taking it that when we come back, now that we've started the flow, we'll be able to get maybe into some particular issues that that persons might be able to benefit from. So thank you so much again, and God's blessings upon you. All right, so listeners and viewers, thank you very much for staying with us today. It really was a pleasure, is always a pleasure. I trust that you are going to have a really great rest of your day and a wonderful weekend ahead until I chat with you or meet with you again next week, Friday. God's will, God's blessings, and goodbye.
You are my strength like no other, strength like no other, reaches to me.